Wound health is not just a concept, it's a clinical reality every veterinarian lives every day. You are uniquely positioned at the interface between animal and human health. You examine, handle, treat, and advise on animals that share pathogens with the people who own them, work with them, consume their products, and live near them. This talk is about the major bacterial zoonoses in veterinary medicine, not as a list to memorize, but as a set of transmission chains to understand. When you understand the chain, you can find the point to break it, whether that's vaccination, pasteurization, PPE, or reporting. I want you to apply this chain model to every zoonotic case you encounter. Let's say you confirm Brucella canis in a breeding kennel. The reservoir is the dog. The shedding route is reproductive fluids, urine, and saliva. Environmental persistence is moderate. Human exposure routes include direct contact during whelping, handling aborted material, reproductive examinations, and potentially blood. The susceptible humans are the owners, kennel staff, and you. Now, where do you intervene? Reproductive isolation of infected dogs, PPE for all personnel handling reproductive cases, reporting to public health, and testing before dogs enter the breeding program. You're not just treating a dog, you're managing a public health event. This is your at a glance reference, but don't memorize it. Understand the patterns. Notice that rodents appear repeatedly as reservoirs: Yersinia pestis, Francisella, Leptospira. Rodent control on farms is not just an agricultural annoyance, it's a public health intervention. Notice that parturition events, birthing, are high-risk exposure points for Brucella, Coxiella, and Listeria. Anytime you're assisting a birth or handling placental material, you should be thinking about what the animal might be shedding. And notice how many of these are foodborne. Pasteurization of milk and safe meat handling aren't just regulatory requirements, they're the critical breakpoints in transmission chains affecting millions of people. Leptospirosis is fundamentally an environmental disease. The transmission chain runs through contaminated water and wet soil, not through direct animal to human contact. The key insight is that rodents are the maintenance hosts. They're chronically infected and chronically shedding leptospires in their urine without any signs of illness. They contaminate farm water sources, puddles, and soil continuously. Cattle and dogs can become incidental hosts, amplifying the environmental contamination. After heavy rain or flooding, when contaminated soil is washed into ponds and streams, human exposure risk spikes dramatically. This is why leptospirosis outbreaks in humans often follow floods. For veterinarians working in dairy herds, urine splash is a genuine occupational hazard. Always wear eye protection and waterproof gloves when catheterizing cattle or handling urinary tract cases and during obstetric work. Fever is a zoonosis that should make every veterinarian doing obstetric work pause. Coxiella burnetii is shed in astronomical numbers in sheep and goat placentas, up to 10 to the 9 organisms per gram of placental tissue. The organism forms a spore-like small cell variant that is extraordinarily resistant to desiccation. It can survive in dry dust for months and travel downwind from a farm for kilometers. The infectious dose for humans is as low as 1 to 10 organisms by inhalation. Let that sink in. You don't need to be elbow deep in a ewe to be at risk. Standing downwind of a lambing shed can be enough. Q fever outbreaks in the Netherlands in 2007 to 2010 linked to commercial goat farms infected over 4,000 people and caused dozens of deaths from chronic endocarditis. Veterinarians advising on sheep and goat herds should be familiar with this risk. particularly for pregnant women and immunocompromised individuals who face the highest risk of chronic disease. Zoonotic disease doesn't end with the animal. When you diagnose brucella in a dog, you have an obligation to communicate clearly with the owner about the human exposure risk. When you confirm salmonella in a backyard chicken flock, the children in that household need to know about hand hygiene and not letting chickens in the kitchen. And many zoonotic diseases are legally notifiable. You're required to report them to public health authorities, not just for regulatory compliance, but because human cases may already be occurring that aren't being connected to the animal source. Veterinarians diagnosed the source of multiple human E. coli 0157 outbreaks linked to petting zoos before human epidemiologists had identified the vehicle. You are often the first to know, act on it. One Health is a framework that makes zoonosis management logical rather than overwhelming. You don't need to memorize the clinical presentation of every zoonotic disease in humans. That's your physician colleague's job. What you need to know is the transmission chain for each major pathogen in your practice context, where the breakpoints are, and which humans in your client's world are most at risk. Communicate that clearly, document it, and report it when required. Those three actions, recognizing the chain, breaking it, and reporting, are how veterinarians protect both animal and human health every day. Read the case, think about it, we'll then work through it together. Pregnancy is a state of relative immunomodulation. The woman is particularly vulnerable to certain pathogens that might cause mild disease in healthy adults, but severe outcomes in pregnancy. Your diagnostic workup should include fecal culture, specifically requesting Campylobacter, Salmonella, and E. coli 0157, plus fecal PCR for Campylobacter if available, given that routine culture has variable sensitivity. Campylobacter jejuni is particularly relevant. It's shed commonly in dogs and cats, especially younger animals, and can cause bacteremia and fetal loss in pregnant women. Listeria is in the back of your mind if the dog has been eating raw food. In your client communication, be clear and calm. Tell the owner which organisms you're testing for and why. Recommend she discuss her exposure with her obstetrician. Advise strict hand washing after handling the dog, its feces, food bowl, and environment. Avoid alarmism. The risk is real but manageable with hygiene. Document the conversation. Read the case, think about it. We'll then work through it together. This is a classic leptospirosis presentation. The combination of farming activities, water exposure, and fever with myalgia 7 to 14 days after exposure fits the incubation period. However, Q fever should also be on the differential, giving the calving assistance. Its incubation is 2 to 4 weeks, so it's slightly longer, but within range. Brucella is possible if she had contact with aborted material, though cattle brucellosis has been largely eradicated in many countries. For the physician, the most useful information is species of animals present on the farm, what she did, calvings, water weighting, general animal contact, PPE used or not used, geographic location, whether any animals were recently aborted or known to be infected with anything, and the time course. This is exactly why medical history should always include animal contact. Physicians don't always ask, and patients don't always volunteer it. Veterinary input can make the diagnosis. The question, think about it, we'll then go through it together. Pasteurization is, gram for gram, one of the highest return public health interventions in history. Milk is an extraordinarily efficient vehicle for zoonotic transmission. It's produced in direct contact with the udder, a common site of bacterial colonization and infection. It's consumed directly without further cooking, and it's distributed at scale. The specific pathogens addressed by pasteurization include Mycobacterium bovis, bovine tuberculosis, historically a major cause of human TB before pasteurization, Brucella species, undulant fever transmitted efficiently in raw milk, Salmonella species, Campylobacter, E. coli 0157H7, Listeria monocytogenes, and Coxiella burnetii, Q fever. The standard pasteurization temperatures and times were specifically validated to inactivate Coxiella, which is the most heat-resistant of these pathogens. The resurgence of raw milk consumption in some communities has directly produced outbreaks of Campylobacter, E. coli 0157, and Salmonella that were essentially eliminated when pasteurization was universal. The veterinarian's voice in supporting pasteurization is grounded in the microbiology you now understand.